It is the battleship. Thank you guys for confirming what I obviously don't know. What I also don't know is medical things. That's why we bring in members of the medical community to talk about it because, like I always say, they have the degree and I don't. Joining us this morning, Dr. Bill Smith with Cape Fear Heart Associates talking about atrial fibrillation. And the very first thing I'm going to say is I'm probably one of these people that sees the commercials on TV if you have AFib. So I know that it's out there. I know based on commercials it can be treated with medicine. But let's first start with the nuts and bolts. What are we talking about when we mention atrial fibrillation?
Atrial fibrillation is the most common heart rhythm disorder that we see. I have some visual aids. I don't know if you can see them.
Hold on. I'll hold them this way. That way you can talk what you need to say.
Normal heartbeat starts in the upper chamber or atrium. And then gets transmitted down to the lower chamber. And atrial fibrillation is a condition on number 2 where the signals in the upper chamber get disorganized. So that instead of it beating in a coordinated fashion, everything beating in unison, the heart is beating very irregularly and chaotically. And it sends signals to the bottom chamber of the heart in an irregular fashion, so it's an irregular heartbeat.
What is it about this ailment that limits it to the upper chambers? What is it that it doesn't really take on the entire chamber of the heart?
There's some tissue in between the upper and lower chamber that fortunately keeps it apart because ventricular fibrillation, which is the bottom chamber, is much more dangerous and life-threatening. That's something you would need a defibrillator for. Atrial fibrillation we treat with different ways.
And the treatments can be, a little bit reading up, I know there's surgical, there's non-surgical, there's also medication you can take. Take us through the ranges as far as the seriousness goes where you would actually do a surgical procedure.
Well, that's a great question. Atrial fibrillation is the most common, but in many respects the most complex because there are lots of different ways to treat it. Stroke is a bad thing that can come from atrial fibrillation, from clots forming in the upper chamber, and we often use blood thinners. Coumadin is a drug we've used for years, and now we have some new alternatives that are actually a little bit better in many respects. You mentioned drugs. There are some medicines that we can use. And then in certain patients, it's not for everybody, but the right patient, there are surgeries that can be done, and more commonly a non-invasive or a non-surgical but invasive procedure called an ablation, where we can put a balloon in the atrium, freeze areas where the arrhythmia is coming from, and get rid of it.
Okay, and so again, I've already proven that I'm not the medical person you want to talk to. If you have any questions about atrial fibrillation or anything otherwise, you always want to contact your medical professional. Again, Dr. Smith, we appreciate the time this morning.
Absolutely.
Thank you for coming on in. Now, again, I don't do weather either. You do, so what do you got over there?